As the number of overdose deaths continue to increase over the years, organizations such as Odyssey House New York City are dedicated to helping people overcome drug abuse and alcohol abuse. Joining us now to discuss the opioid epidemic along with the organization's programs, we welcome now the Odyssey House NYC Senior Director of Outpatient Services, Mary Callahan. And thank you for coming and sharing with us.
Thank you for having us and getting this important topic out into the community.
It is very important when we talk about, opiate use. A lot of people are, being affected. Families are being devastated. But first of all, let's talk a little bit about Odyssey House and the work that you guys are doing, really in working with families.
Yeah, so Odyssey House is a community-based organization that has been in existence in New York City since 1967. We just had our 50th anniversary. We do work with individuals and families, providing community-based substance abuse treatment services, mental health services, supportive housing, and family services. We cover the continuum from recovery on the front end of treatment, where we're introducing the possibility of recovery to clients that we meet in the community by opening up recovery centers in the community. And then we provide treatment across the board, from outpatient treatment to residential long-term treatment, and also provide housing at the end of treatment for individuals who qualify.
So when we talk about those people who are seeing treatment, are we seeing rises in numbers? What are you saying?
Yeah, so New York Times did a study from 1980 up until 2016, and they noted a rise from 10,000 to almost 65,000 deaths due to opioids in really across the country. In Odyssey House, over the last couple of years, we've seen a rise of 5 to 6% in our residential and outpatient treatment programs.
That's a big number.
It is a big number.
And a lot of people are talk about the opiate issue, because a lot of people are really suffering dealing with this, and this has become the drug of today.
Yeah, I really want to say the reason why, there's multiple reasons that opiates have risen so tremendously over the past several years. I think a lot of it began back in early 2000s when there became more available, stronger types of opiate medication, such as OxyContin, which are really prescribed quite freely in emergency rooms and in primary care practices to individuals. So individuals who wouldn't ordinarily be introduced to substances like heroin may be introduced because they had back pain or something of that nature, and the doctor may have prescribed an opiate to them, and it's a pretty quick transition for some people. For some people, you take a drug and it really doesn't affect you at all. Others, because of physiological reasons that are just in existence, just like some people have high cholesterol, some people are predisposed to become more dependent on substances. So these individuals are now prescribed this medication, which created by the pharmaceutical industry, which became stronger and stronger than like a Vicodin medication, and pretty soon they're taking it more and more frequently. Doctors may stop prescribing it because it's not being used for the correct reason. It's now become a substance of abuse, and these individuals may transition now into street opiates such as heroin. And now that has been exacerbated because preying on vulnerable people, there's not only street heroin available, but there are really strong pharmaceutical type medications such as fentanyl, which are thousands of times more potent than heroin and are causing the rapid rise in overdose.
So when you have a family member, some people have family members or know individuals who are really being affected by this and other drugs. What is your recommendation in terms of trying to help them to get to a place? I mean, you guys always have an open door, but to create that conversation, to get somebody through the open door is really the big challenge.
Yeah, treatment really has to be seen on a continuum, and I know we do a lot, and many providers do a lot on the prevention aspect, so we go into schools and provide education on the front end. We have recovery centers in the community. We have one just opening up in the Bronx on Davidson Avenue, which is really a place where anybody can walk in and provide receive information and family services related to substance abuse and on how to help their family and resources that are available. We also have training programs for individuals who abuse substances themselves, and also for family and friends that can teach individuals how to stop an overdose once it happens. So there's a medication that now we train many people in the community, but also it's been rolled out in the fire department and in emergency services, where everybody is equipped with a substance called naloxone. And naloxone is a quick nasal spray, 2 pumps, 4 milligrams, where an overdose can be stopped in its tracks. So we have trained many family members on the front end and the fire department. And I want to say that part of the reason why this has become so readily available over the last couple of years is because in New York State, we're very fortunate that we have a governor such as Governor Cuomo, and in New York City, a mayor such as Bill de Blasio, who has a strong emphasis on education, prevention, and on the community approach to healthcare.
And when we talk about this particular issue, we hear about the harmful effects. We hear about people who've died from it. But share with us a little bit. Are you experiencing a lot of recovery stories?
Yeah, so there's always great recovery stories, and I want to say that over the last year, a year or two in Odyssey House, we've had to really go from totally what we used to refer to in the treatment world as drug-free treatment because of the opiate crisis to providing something called medication-assisted treatment, because individuals who have opioid use disorder, so now they've taken opioids for some time, and it's a very, very powerful substance that binds to molecules in the brain. And when somebody tries to stop taking opioids, what happens is often their brain does not normalize. So now, even if they're struggling and trying to move into recovery, what can happen is they relapse because of the tremendous withdrawal symptoms and because they never really get back to that normal feeling. What's normal for them when they're high on opiates, now when they stop, it feels like a low-grade depression all the time. So that's why we have now started providing medication-assisted treatment, which are things that people are familiar with, like methadone, which is one type. Another type is Suboxone, and then there's another type, Vivitrol, which is a long-acting, once-a-month injectable medication, which help with the recovery process. So individuals on opiates who previously may not have been successful with traditional treatment now have been enabled to be much more successful with medication-assisted treatment. In addition, our services include wraparound wellness services where we introduce individuals to positive healthy behaviors like running programs and things like that. We have a running program where every year patients that we work with and staff run together in the New York City Marathon, and many individuals who participated in that program, which has been in existence since 2000, have achieved long-term recovery and come back and give back to the community over and over again for the last 17 years.
That's awesome. And so we want to tell people, if you want more information, make sure that you go to OdysseyHouseNYC.org, and I'm sure Mary and her staff can be able to direct you there. Thank you so much for coming and sharing with us.
Thank you so much. I appreciate it.
Mary Callahan, our guest here in studio. We want you to stay tuned because guess what? We got more show coming up right after these messages, so don't go anywhere. We're coming right back.